Welcome to Earth 2.0. I'm Anita Casalina. As the coronavirus has spread around the world, it has generated a lot of fear. And some of that fear comes from people not knowing how they might have become infected. So contact tracing has become especially important to help map the spread of the virus and allow us to feel safer as we open up the world again. Our guest, Micha Benoliel, is the co-founder of Coalition Network and has developed a free Bluetooth-powered contact tracing app for smartphones. But Micha and his team have been developing Bluetooth-powered apps for years, and these apps have been used in countries around the world where rapid communication among people has been critical, and there's often no internet signal. This kind of technology will be essential to help bridge some of the communication gaps in our world. Hello, Micha.
Hi, Anita.
It's so nice to have you join us today. Thank you so much. I know you're busy because there's nothing more important right now than contact tracing, and I'm sure you're in demand, so we appreciate you being with us today. So tell us about how this app that you have developed works for contact tracing.
So the Coalition app is a very simple app. The purpose of the app is to alert you if you have been in contact with people or someone who was tested positive or was infected by the coronavirus. And it's an app that we've built with the team with a privacy by design approach. So we wanted basically to make it as private as possible because when it comes to under the skin health basically issues, it's always very delicate. And so we wanted to make sure people feel comfortable using this app.
So how does that privacy work? Because I know that would be the first question a lot of people would ask is, I don't want people tracing where I've been and what I've done. So how does it keep people private?
So it's a very good question, and I'll try to explain that very simply. So the app keeps all the information on the phone. It generates random identities, so you never have to register on the app, for example. You never have to give up any personal information. And it uses Bluetooth to broadcast these random identities. So when you are in contact with someone, so in proximity, it records the random identity of the person you have been spending time with and the time you spent. And all that information stays on your phone.
Okay, so now that you've used that term Bluetooth technology, I think you need to explain that a little more in detail, but in simple terms.
Okay, so the Bluetooth interface on your phone, you can compare it like your phone becomes like a hotspot or a base station, and it will broadcast a small signals, and that's how it can connect to other phones nearby, and the phones will then exchange these random identities automatically. And that way you can collect identities from many phones around you, and they can do the same if they have the Coalition app also installed on the phone. And what happens is if someone in the group gets infected or is tested positive, they can declare basically that they have been tested positive. And in that case, the history of their past 14 days of random identities or anonymous identities is shared with other phones. You receive that on your phone, and then your phone computes if you have been in contact with that person, and then it will alert you if you have been in contact with that person and tell you, oh, you have been in contact with people or someone who was tested positive. We recommend that you stay at home and that you check if you have symptoms and call your doctor.
So it's interesting because that level of privacy also keeps from really identifying people. So you kind of walk a fine line. Where are the people who are infected? What are their actual names? How do we find them? Versus we want to remain anonymous and private. How then can the epidemiologists or the medical community find out who those people are? Is that through the phone numbers, or how are we able to find them?
It's a very good question, and the system is evolving actually to be able to provide more tools to health organizations or governments. For example, we work with a few governments, the government in France, the Senegalese government in Africa, to help them with the integration of the technology that's inside the Coalition app. All this is anonymous, and that's how you can preserve people's privacy. What we recommend to a user through the web interface is if they have been alerted and they need to call a doctor. And that's how we can assist them the best, or call 911 in the US, for example.
Okay, well, I installed the Coalition app in my phone last night, but I would have to be near somebody who has the Coalition app for it to really trigger. Is that correct?
That's correct.
Okay.
Or with any other contact tracing app that's basically interoperable with the Coalition app. And we're also working on that.
It would work with some of the partnerships that you have, is that
Absolutely.
Okay. Okay. No, it's very interesting and very diverse, these countries. You've got France, Senegal, and then the city of Berkeley, which of course is its own country, right?
Absolutely.
They make all their own decisions over there. It's really interesting, but it still is dependent on self-reporting in a way, or as you call it, declaring, right?
Yeah, so that's the way it's working today. And as we improve the system, we are going to release a new version in the coming days or week, where we give the users the possibility to communicate what we call a safe code with the lab that is testing them. And the lab or the doctor can use that safe code then to directly communicate the results to the user within the mobile application. And that way, if you are tested positive, you will receive a certificate on your app that basically confirms the results of your test.
Well, you started working on this not long ago. I mean, we're talking about a couple of months now, and you've already come this far. So, of course, I'm asking all these questions like, well, what about this and this and this? You've only been working on this, what, 2.5 months or something?
Yes, we've been working on this since the beginning of the confinement in San Francisco.
Yeah.
And when my team and I realized that we were very compelled to bring actually a solution for contact tracing on mobile, because we had been working on these problems and with these technologies for almost 10 years now.
Firechat was the previous app that you developed it took off and had a life of its own without you even expecting it. Isn't that correct?
Yeah, so Firechat was it's a very interesting story. We started the app for Burning Man in 2014, and the idea was that because there is almost no connectivity at Burning Man, you could be using a messaging app that works when there is no internet. So we launched Firechat for Burning Man, and then it ended up being used in situations we didn't expect, like pro-democracy protest or disaster recovery situation. And it was the app that helped the students in Hong Kong for the Umbrella Revolution, so back in 2014, in September, October 2014, yeah.
It is not connected to internet, so governments can't shut it down. I know that the Hong Kong government probably tried to see if they could somehow limit that connectivity that the students had, but they couldn't break into it. Is that correct?
So what happens is with these technologies, and we call that peer-to-peer mesh technologies, and with smartphones and the Bluetooth interface or other wireless interface that you have on the phone, you are able to build, when you're in proximity with other people, your own network. And indeed, you don't need to rely on the internet. And that way you can exchange messages, for example. That was the case with Firechat. Today we use this same Bluetooth wireless interface for contact tracing to just exchange identities and measure the time you spent with people around you. But it's basically the same principles. It's like your phone is independent. It doesn't need to be connected to the internet. And you can still exchange information with people and phones around you.
So this is almost like a second level of the internet. This was the original dream of the internet, was that it was going to be free communication for everyone, right? Like communication for the people. And of course it's become commercialized, and here in the US they're trying to control who can have how much access, and then it develops that kind of social and economic stratification. So this ties all people together, right? This is a leveler, yes?
I think it realizes the vision of the internet, where basically it goes even beyond, where everyone can become their own hub and have their own node on their smartphone today. I mean, everyone has a smartphone with them almost. And yeah, it brings basically the independence of the internet to the edge of the network, to another level. And I think it's going to become, we're going to realize that these technologies can help solve some of the most difficult problems. And contact tracing is actually a way to open the eye of the people on this new generation of wireless and networking technologies.
What other kinds of issues and problems do you think that this sort of technology can solve moving forward? Because of course I'm really interested here at Earth 2.0. Our focus is, what do we do after this pandemic? Is there a way to build a world that really connects people and is more peaceful and more sustainable? How does this kind of app fit with that?
So the first thing we have to solve is and we've seen that with with the coronavirus is we realized that, I mean, this kind of crisis can basically shut down almost the economy. What we can do, the first thing is by using contact tracing app, we can help basically get people back at work, and we can help prevent future pandemics using this technology. And I think that's very important. It's also a very small and little effort, because now with these technologies, a contact tracing app, you can have basically, you can prevent this from happening again, and have all of us being end up stuck at home like we did, and almost having to shut down the whole economy. So I think that's a big enough problem to solve now that could be solved using these technologies. There are much more things that can be done, especially in emerging markets where people don't necessarily have always on access to the internet, using these edge technologies. Yeah.
I think there's going to be a lot of need for this kind of technology as we move forward, because as you're saying, other issues are going to come up. It would have been great to have had this in place in advance when all of this began happening with the coronavirus, when some of the first cases were showing up. We're just really, really excited by the development of what you're doing here. And keep up the wonderful work. Make sure you get a lot of sleep too, because I know you're probably under a lot of pressure to get this done as quickly as possible. Thank you so much, Micha, for joining us today. We're really, really happy to have you.
Well, thank you, Anita.